Thank you both for those wonderful presentations. We are right at our scheduled time to end. If you need to slip out, feel free. I'd like to take maybe 10 minutes and then run over there for questions. So if any questions.
Maybe I could go first and just ask the previous speaker, who was so wonderful, really, and Sudan is so terrible. The data I've never, the shocking data. This cultural norms, changing cultural norms, how do you respond to that?
I think there are some cultural norms which we have to work with, not necessarily to change them, because they didn't come yesterday. So we can't begin to think that we can change them. A good example is one of the reasons, biggest reasons why women in Sudan prefer delivering at home or at the TBA place is associated with the practice of taking the placenta and having some ceremonial things with it. So the husband and the in-laws cannot let this woman go and deliver in a hospital where they are going to throw away that important piece. In fact, the TBAs fidget between, as soon as the woman delivers, they fidget between checking on the woman and going ahead to begin the process of washing and doing this and putting it on top of this and so on and so forth. It's a whole process of how to treat the placenta. So we can't change that. But we can ask the midwife to bear that in mind, I mean the TBA to bear that in mind and deliver this woman at the facility and give them the placenta, and they do what they have to do with the placenta. So it's a little bit of that. So we are not saying that some of these cultures, like there is also another culture of delivering in the heart by the on a squatting on a hall.
Oh.
Yeah. So we in Ghana 2 years ago we had the case in Ghana where almost a similar tradition is, and what they did in one of the innovations was for the FBO facility to innovatively put a hole in the delivery room. And when women heard that the thing was there and the bed was also there, they said, oh, there's a hole in there, we can go. They went. So some of the traditions, it's an issue, a matter of acceptability. What is acceptable? The minimum acceptable thing that can work alongside the modern practices.
That's a good idea.
So that's what I was referring to, that some of the advocacy is around encouraging them to continue doing what they've been doing, but in a different way or alongside the recommended practices. There's also a practice of the chiefs actually make many decisions regarding rape. These are cases which don't go to ordinary courts. These are cases which go to what you would call the village court. And the village court has a chief, and the chief will always rule. You bring the case if you have you've been raped, whether you're a married woman or not, and the chief will rule and say, this has to happen. You have to go with this man, or you have to go with this man. So it is, if you bring together these chiefs to put some insight as to what are the issues associated with forced marriage, associated with arranged marriage, and so on and so forth, eventually they will begin to rule probably differently. So we are not saying that we can tackle the cultural practices and get rid of them in a day. We're only saying that if there's anything we can do to work alongside some of what they die for. There is a practice, so there are some spearmen called spearmen in most of the tribes in Sudan, obstructed labor goes to the spearman. Okay? It is scary, you know? But the law, apparently there is no law that forbids them from doing that. It's a culture which continues, especially with the Dinkas, and they will pierce the baby out. That's their job. So in so doing, they cause a lot of other damages, and women die, or women end up with the fistula. And then when they have fistula, then they are abandoned, rejected. They are put in some little hut to die there. So it's some of these things, if they are put to public dialogue, for people to know that how else could we respond as neighbors, as members of the same community.